The Newsday continues here on One News Now. I'm Charles Lejano. The COMELEC reveals around 95% of individuals who filed their COC for president could be scrapped. In an interview with Agenda, COMELEC spokesperson James Jimenez said that it's obvious that most of the 97 presidential aspirants won't make it to the final list. Jimenez also admitted that Senator Bato de la Rosa is an outlier among aspirants because he's qualified to run for president, but he could also be a nuisance candidate.
Ang problema sa kanya, inaamin niya na okay lang sa kanyang ma-substitute siya. No? So parang lumalabas ngayon sa mga tao, parang inamin niya na rin na placeholder siya. Isa dun sa mga kategorya ng nuisance candidate, mukhang nag-a-apply sa kanya. Yung which is a person with no bona fide intention to run for office.
Yeah.
Because if you're saying na okay ka lang napalitan, di asan dun yung bona fide intention mo to actually throw your hat in the ring?
COMELEC spokesperson also said that they have started disqualifying some of the 270 party list submissions. This as he confirmed that many of these submissions could be considered a joke.
Yes, they are. And just to stoke your outrage a little further, we have 270 party lists trying to participate in the coming elections. Okay, 270 party lists. Marami po dyan ang madi-disqualify. In fact, marami nang na-disqualify ang COMELEC, no? Out of the more than 100 new applicants, we've already disqualified a significant number. So, pero under appeal pa lahat.
The health department is estimating that 90% of the target population in Metro Manila could be vaccinated by the end of the year. To discuss this, we have Greg Gregorio now joining us live from Mandaluyong. Good morning, Greg. So could you tell us whether LGUs can start vaccinating members of the general population already?
Good morning, Charles. According to Health Undersecretary Maria Rosario Vergere, LGUs can now start vaccinating the general adult population. It is up to LGUs, though, if they would want this rollout be via walk-ins or otherwise. But the DOH is reminding LGUs to keep or to maintain dedicated lanes for senior citizens and people with comorbidities, as these sectors are still the ones that are most at risk for contracting and suffering from the disease, and they're still the ones being prioritized for the vaccine rollout. Charles?
Greg, what about pediatric vaccinations? Will the initial rollout push through on Friday? And if so, do we know which vaccine brands will be used?
Yes, Charles, according to Undersecretary Vergere, the pediatric vaccination on Friday, October 15, will push through, as there are already 8 hospitals being identified as venues for the initial rollout of these pediatric vaccination for ages 12 to 17 with comorbidities. Vergere said we will be using Pfizer and Moderna vaccines, as these brands of vaccines are the only ones with emergency use authorization here in the Philippines for these age bracket. Charles?
Greg, will the alert level system in Metro Manila be downgraded this weekend according to authorities? And just refresh our memory, what conditions must be met so this can happen?
Charles, according to Vergere, they can't say just yet if the alert level systems over the national capital region be de-escalated to alert level 3 by weekend, because Vergere said there will be a series of meetings with other members of the IATF starting today. But aside from the declining number of cases, Vergere said authorities would have to consider all other factors or all other indications for the possibility of de-escalating the alert level system. This could be the utilization of the hospital beds and ICU beds, and for the shortened period for the detection and isolation of an individual or of a positive individual, among others. Charles?
Yeah, we're noticing that restrictions are loosening across the board, Greg. Let's talk about the pilot run of face-to-face classes. Do we have any updates on this?
Charles, according to Vergere, since the children that will be part of the pilot run of the face-to-face classes aren't part of the vaccine rollout, Vergere said that what has been agreed upon by child experts, including DOH and the Department of Education, those individuals or teachers and non-teaching professionals or personnel in these areas where the pilot run of face-to-face classes will happen, they will be the ones who have to be vaccinated, not the children, because as the Department of Health has explained, there are still no recommendation for the vaccination of children or of minor without comorbidities, and especially that we don't have EUA yet for any brands that will cover children ages 11 and below. Charles?
Greg, given the current trend, what are the chances of us having a better Christmas this coming December?
Charles, according to Vergere, if we will be able to sustain the continuous decline of the positivity rate, the daily average new cases, and the growth rate and the utilization of hospital beds in the country and in the National Capital Region and other parts of the country, we may be able to see a better situation come Christmas. But according to Vergere, there is still no room for complacency, as if the number of cases will increase again or the trend will be affected, the authorities might have to maintain or maintain the current restrictions that we are having up until Christmas. Charles?
Thanks for that, Greg. That was Greg Gregorio reporting live from Mandaluyong. With a pilot run of the reopening of schools fast approaching, the World Health Organization tells us how we could keep schools safe amid the pandemic. Let's listen in.
As many countries are putting in place measures to protect students and staff and also larger communities safe and keeping them safe during this phase of the pandemic, what are WHO's recommendations to keep communities safe?
That's right, Vismita. Many countries have put in place and are putting in place precautions to keep schools open safely during the COVID-19 pandemic. Schools operate in communities, and the first thing is to make sure that we try to drive transmission down as much as possible in those communities, because the individuals that work at those schools live in the communities. Second is to ensure that we have good systems in place within the school system to be able to monitor the health of the students and staff. This is a plan to be able to detect cases, to ensure that children who are unwell stay at home, to make sure that there's good communication with the students themselves, the faculty, as well as the parents, so that they know what to do if a student is unwell or if a teacher is unwell, to make sure that there's good provisions within the schools to minimize the opportunity for spread of the COVID-19 virus. This is about disinfection, it's about improving ventilation, about distancing, about wearing of masks, and if there's vaccines available in the areas, to make sure that the vaccination is undertaken in those communities among the priority groups who live there.
Maria, during this pandemic, we've seen how important it is for students to have that continuity of education. Let's go a little deeper into what steps a school should take if a case is detected.
So that is a great question. It is really important that students have that continuity in terms of their education and their safety and well-being. It's about having a plan in place. First of all, if students are feeling unwell, we recommend that they stay home and that they're cared for by a parent or a guardian at home. If there are cases in the school, they need to be able to be detected so that they can receive the proper care, they can receive a test, they can receive the proper care that they're needed based upon the symptoms that they have. And then we recommend there to be contact tracing. So the same as we do in the general community, if there is a case that is identified, what we want to do is make sure that we prevent the opportunity from that virus from transmitting from one individual to another. So it's important to identify the contacts of those children, and those children be in quarantine for a certain number of days so that they don't have the opportunity to spread should they be infected. But all of that requires detailed planning by the school. It requires good communication with the students themselves, first of all, to take the measures to prevent themselves from getting infected and passing to others, but also to know what to do if they are feeling unwell or if they happen to be a case.
18 former NBA players are facing charges for attempting to defraud the league's healthcare plan of almost $4 million. Let's get the latest on Bloomberg Quick Take.
Today, we announced charges against 19 individuals for conspiring to defraud a health care plan that provides benefits to active and former National Basketball Association players. The FBI arrested 16 defendants this morning in 12 districts across the country. These 19 defendants, including 18 former professional basketball players, are all charged with participating in a conspiracy to defraud the NBA health benefits plan. The defendants charged today defrauded the plan when they falsely made claims for reimbursement of medical and dental services that they had not received. As alleged in the indictment, the leader of the conspiracy was former NBA player Terrence Williams. And here's how it worked. First, Williams obtained fraudulent medical and dental invoices. Second, he sent those invoices to his co-conspirators, other former NBA players. Third, the co-conspirators submitted the fraudulent claims to the plan. Fourth, unaware that the claims were fraudulent, the plan paid most of the defendants' claims. And fifth, in many cases, the defendants paid kickbacks to Williams.
Here's a quick look at some of today's headlines. Voter registration for the 2022 elections resumes today. A Filipina nurse dies after a mugger knocked her to the ground at Times Square. And actor Jake Cuenca was arrested after a police car chase in Mandaluyong. And those are the top stories at this hour. Join us again later at 1 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.